Hi everyone. For this segment of training, we'll be covering Quantity Family Services policies and procedures for medication administration and monitoring. Following the completion of this training, the expectation is that employees and resource parents will demonstrate both competency and understanding of Quantity Family Services policies and procedures regarding the administration and monitoring of medications. Also following this training, staff and resource parents will be able to identify and accurately complete pertinent medication documentation forms that are utilized by the agency. Over the next several slides, you'll be presented with Quantity Family Services policy on medication administration and monitoring in its entirety. Click the arrow to the right to move forward and progress through the policy at your own pace. Please carefully take your time and read through the memo because upon completion you will be presented with a statement of understanding and acknowledgement. The maintenance of clear and concise records is always important, but more so when dealing with medication administration and monitoring. Over the next slides, we will review the various forms that both resource families and Quantity staff will be utilizing. Quantity Family Services utilizes a number of forms that is used to track and monitor all medications provided to the child or the youth that's in placement. These forms include PRN authorization forms, monthly medication records, medication transfer sheets, and centrally stored medication and destruction records. As we go through the next slides, I will present each of these forms and explain the importance of having each section filled out and also an example of each of the forms that will be used. The PRN authorization form is a two-page document that is typically completed on the first medical appointment. This form is signed off on by the treating physician and serves as written authorization for the child or the youth to receive prescription or non-prescription PRN medications. Page 2 of the PRN authorization form pertains to over-the-counter medications. Over-the-counter medications cannot be administered without prior approval from a medical professional. This page must also be completed at the first medical visit before any over-the-counter medications can be administered to children or youth in placement. Let's take a look at a PRN authorization form when completed. All the highlighted areas must be completed, and Quantity staff and resource parent are responsible to ensure that the form is dated and signed by a medical professional. And on page 1 of the PRN authorization form, the medical professional has checked the circumstances that best describe the child or the youth in placement. Let's take a look at a PRN authorization form when completed. All the highlighted areas must be completed, and Quantity staff and resource parent are responsible to ensure that the form is dated and signed by a medical professional. And on page 1 of the PRN authorization form, the medical professional has checked the circumstances that best describe the child or the youth in placement. It is important that a signature is present on page 2 as well. It is also additionally important that if an over-the-counter medication is to be excluded, it is clearly marked on this form. The monthly medication record is used to record any medication that a child or youth receives while in placement. This form is completed for each medication is collected on a monthly basis by Quantity staff. The monthly medication record is used to record any medication that a child or youth receives while in placement. This form is completed for each medication is collected on a monthly basis by Quantity staff. The medication transfer log is used to document the transfer of any medications the child or youth may be taking with them while leaving the resource home for a period of time when regularly scheduled medication has to be administered or monitored by someone other than the resource parent. When completing the medication transfer log, the resource parent must ensure that all the areas highlighted are completed, and a copy of the pharmacy printout is attached to the medication transfer log. The responsible person must also acknowledge receipt of the medication and the quantity of medications being transferred. Upon the child or the youth's return, the resource parent should also verify the quantity being returned and record any missed dosages. The centrally stored medication and destruction record is used to track medication that has to be destroyed. These medications include medication that is expired and also discontinued. The completed centrally stored medication and destruction record must be kept in the child or youth's file at all times. Each highlighted section must be completed and reflective of the information obtained from the prescription. The completed centrally stored medication and destruction record must be kept in the child or youth's file at all times. Each highlighted section must be completed and reflective of the information obtained from the prescription. The next several slides presents a number of questions and/or scenarios that may arise while the children, youth, and non-minor dependents are in placement. The expected action steps serve as a quick reference to Quantity and Family Services policy and procedures on medication administration and monitoring. How is medication to be stored in resource homes? All prescription and non-prescription medication must be locked and inaccessible to children or youth at all times. A non-minor dependent may store his or her medications and injections in his or her possession, but all stored medication must still be safely stored and inaccessible to other children or youth in the home. Medications must be stored in accordance with the label instructions. For instance, if medication requires refrigeration, it must be refrigerated. If it requires being at room temperature, it must be in room temperature. Or if it's also indicated that medication should be stored out of direct sunlight, please follow all the instructions that are specified on the medications. Prescription bottle labels cannot be altered by anyone other than the dispensing pharmacist. So prescription medication for children that requires refrigeration must be centrally stored and locked in a receptacle, a drawer, or a container. The medication should always be kept separate from other food items. And all records of all centrally stored medication must be maintained at all times. When a child or youth is placed in a resource home with medication, it is the responsibility of the Quantity and Family Service staff or the resource parent to contact the pharmacy or possibly the prescribing physician to obtain a copy of the pharmacy printout for the medication currently being taken by the child or the youth. The resource parent or the quantity and social worker will also inspect containers to ensure the labeling is accurate and the medications have been taken as prescribed. For example, the resource parent or the quantity and social worker will count the number of pills remaining and compare to the date the prescription was filled and the instructions for usage. Each medication will be recorded on a medication log, and the log will be stored in the child or the youth's client file. Quantity and Family Services will also discuss with the placing social worker, birth parents, physicians, or the pharmacy the conditions, symptoms, or concerns that the prescribed medication is targeting. If a dosage is changed between refills, written documentation must be provided that reflects the dosage change in the child, youth, or non-minor dependent's record. This documentation must include the date and time of the conversation with the prescribing physician, or an attached and updated prescription must be recorded, logged, and documented. If a new prescription is filled as a result of the dosage change, the resource parent must contact the quantity and social worker to ensure that the unused medication is properly disposed of. If any concerns or reported side effects is noticed due to the change in dosage, this incident must be documented and reported to the prescribing physician immediately. Medication refills must be handled in a timely and efficient manner. Resource parents should make every attempt to never allow medications to run out unless instructed by the physician. Resource parents should also ensure that refills are ordered promptly, preferably a week ahead if possible. Resource parents should inspect all refills to ensure that the information is correct and note any changes in dosage or brand on the monthly medication record, and report these changes to the Koinonia Family Services social worker. In order to destroy or dispose of a prescription medication, several steps must be followed. Prescription medication must be destroyed by the Koinonia Family Services social worker or designated substitute and another employee. Every prescription medication that is destroyed must be recorded and logged on the centrally stored medication and destruction record. The record of a prescription that has been destroyed must be maintained in the child or the use file. When a medication is permanently discontinued, it is required that written documentation be obtained from the physician that the medication will be discontinued, and the documentation should include instructions for tapering the medication if needed. Written documentation of discontinuation from the physician should include the date, the time, and will be recorded in the child or youth's record. Any observations of side effects due to the discontinuation of a medication should be documented and reported to Koinonia staff and the physician. Any remaining medications should be destroyed according to the medication destruction procedures. It is important to check containers regularly for expiration dates. If a medication is expired, you must communicate with the physician, the pharmacy, and your Koinonia social worker promptly in order to obtain a refill as soon as possible. Over-the-counter medications and ointments also have expiration dates. For ointments, the expiration is usually at the bottom of the tube. Destroy all expired medications as soon as this is noticed. All medication, including over-the-counter medications, should be transferred to the possession and control of the authorized representative upon discharge of the child, youth, or non-minor dependent. Document when medication is transferred with the child or the youth. It is good practice to account for the quantity of the medication being transferred. Obtain the signatures of the person accepting the medication, for instance the authorized representative, whenever a child leaves placement. If the child or the youth is absent without leave or AWOL, his or her medication should be retained until the client is discharged. If the child or the youth dies, his medications must be destroyed, following the destruction medication policy. Any missed medication should be documented on the child or the youth's monthly medication record. For instances of missed medication, refer to the physician's instruction or consult with a pharmacist for guidance. Notify Koinonia Family Services staff as soon as possible to advise of any missed medication. An incident report is required if missed medication threatens the physical or emotional health or the safety of any person residing in the resource home. When a child or youth refuses a medication, it is understood that a child or youth cannot be forced to take any medication. Resource parents are asked to ask the child or youth why he or she is refusing the medication. They are then to document the specific reasons why the child or youth is refusing the medication. Refusal of medication may indicate a need for consultation with the child or the youth's physician. Resource parents are also to notify the Koinonia Family Services staff immediately following any medication refusal. An incident report will need to be created if the medication refusal threatens the physical, emotional, or the safety of any person residing in the resource home. If directed by a physician, a medication may be crushed or altered to enhance swallowing or taste, but never to be disguised or slipped to a child or youth without his or her knowledge. Koinonia Family Services staff must be notified of all orders to crush or alter medication before it is given to a child or a youth. Written documentation must be maintained in the child or the youth's records. of any medication that is ordered to be crushed or altered. Documentation must also include physician's orders specifying the name and dosage of the medication to be crushed, verification of consultation with the pharmacist or physician that the medication can be safely crushed, and if there is food or liquids that can be identified in which the medication may be mixed. When preparing medication that can be poured, it is imperative to have clean and sanitary containers, counting trays, pill cutters, pill crushers, and storage and setup areas. The medication must be stored in its original container and not transferred between containers. Resource parents should pour medications from the bottle to the cup or utensil to avoid touching or contaminating medications. If providing medications to a number of clients that are in the home, the name of the child or the youth should be on each cup or utensil which is used to distribute a medication. Medication should not be set up for more than 24 hours in advance, and refrigerated medication must be kept refrigerated until it is actually needed. When a child or youth leaves the resource home for a short period of time during which one or more doses of medication is needed, the resource parent must provide the medication to the adult responsible for the child or the youth's care. The resource parent will give the full prescription container with instructions for administering the dose to the responsible adult or authorized representative. Or the resource parent will have the pharmacy either fill a separate prescription or separate the existing prescription into 2 bottles. The resource parent will also ensure that the medication is given to the adult authorized to escort the child or youth, and the resource parent will have the adult entrusted with the medication sign a medication transfer form, which identifies the number and the type of medication that is to be sent out and to be returned. Upon return, the resource parent must update and maintain the medication log of all medications that were sent out and returned with the child or youth. A child or youth who has a medical condition requiring the immediate availability of emergency medication may maintain the medication in his or her possession when the physician has ordered the medication and has determined and documented in writing that the child or the youth is capable of determining his or her need for a dosage of medication, and that the possession of the medication by the child is safe. This written determination by the physician is maintained in the child or the youth's record by the resource parent. The physician's determination also clearly must indicate the dosage and quantity of the medication that should be maintained by the child. Resource parents that accept children or youth with special healthcare needs shall assist the child or the youth as needed and upon request with the self-administration of prescription medication injections. If the child or the youth is unable to self-administer an injection, then the resource parent must assist and administer the injection to the child or the youth. In the event of an emergency, a person trained to administer injections by a licensed healthcare professional may administer emergency medical assistance and injections for severe diabetic hypoglycemia and anaphylactic shock to a minor child or youth. The physician's medical assessment should contain documentation for the need for injectable medication. The resource parent must ensure that sufficient amounts of medication, test strips, syringes, needles, and other supplies is maintained and stored properly. Syringes and needles are to be disposed of in a container for sharps, and the container is to be kept inaccessible to children and youth that are in the home. Resource parents are responsible for protecting a child, youth, or non-minor dependent's health and safety in the self-administration of over-the-counter medication. Good practices include ensuring that over-the-counter medications are centrally stored in the resource home, that over-the-counter medication is given on an as-needed basis and is provided as directed and recorded on a medication record. The resource parent also must obtain written documentation of the physician's approval of the use of all over-the-counter medications that are or may be taken by the child or the youth on a regular basis. This concludes our presentation. Thanks so much for listening.